Does the Nuss procedure worsen scoliosis? Pectus excavatum, which is the sunken chest, is not only related to the compression of the heart and lungs, but is also directly associated with the spine. Scientific studies show us this. When the Nuss procedure is performed at the appropriate age, it does not worsen scoliosis. In fact, it even leads to improvement in some patients. In a study conducted in Italy with 67 patients, the scoliosis angle improved by an average of 1.5 degrees. In a large series from Korea involving 468 patients, curvatures regressed in those who underwent surgery at an early age. In another study with 100 patients, although a slight angular increase was observed in some children, it did not cause any clinical problems. As thoracic surgeons, we closely monitor the spine after surgery. Moreover, starting from the 3rd month, we strengthen posture and the spine with special physiotherapy support. In short, the Nuss procedure does not only correct the chest wall, it is necessary to address the spine, posture, breathing, and self-confidence together. That's why this surgery must absolutely be performed by a team specialized in Pectus deformities. Now, as Pectusname, I have given you a summary of the articles. Now, based on our own experience, this is what we observe. If the patient comes in with scoliosis less than 15 degrees, not immediately after the surgery, but sometimes right after, families tell me, "Doctor, the curvature has increased, he looks crooked," and they panic. I tell them, no, don't rush. During the first 3 months, as the child gets used to the bar, experiences pain, a pulling sensation, and the tissues need to stretch. This can cause the child to bend to the sides. In the 3rd month after the surgery, we reevaluate the child using the scoliosis chart, scoliosis X-ray, and according to scientific measurements. And if we truly detect scoliosis here, then we refer the child to physiotherapy, and the physiotherapists provide the remaining correction for the child. Why don't we do the evaluation earlier, before the surgery or even earlier? Because the existing angle might be incorrect. For example, there is a curvature like this in the spine, and the bone is also curved in this direction. When I correct this, the spine can straighten, and in fact it does straighten. In cases of scoliosis under 15 degrees, there isn't a significant improvement. If it's over 15 degrees, in 1/3 of cases, it can actually get worse. In another third, it can improve, and in the remaining third, it can stay the same. Our biggest advantage here is this: even if it gets worse, we're actually not the ones causing it. The bone had made 2 wrongs into a right. When we corrected the bone, the real problem became apparent. We didn't cause it. The actual degree that existed was revealed. We see this true degree in the 3rd month after surgery. We act accordingly. This also enables the correction of the curvature in the spine. Based on the actual degree, we first correct the deformity in the front, then we correct the deformity in the spine, and it gets fixed. But as I said, up until now, no Pectus case with less than 15 degrees has ever required any additional treatment. All of them are corrected by Pectus surgeries. That's why you shouldn't consider Pectus as just a chest wall deformity. Instead of doctors who approach it this way, try to choose physicians who consider Pectus as a whole, taking into account the functions of internal organs such as the diaphragm, heart, and lungs. Try to choose doctors who specialize in Pectus. Thank you.